growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Welcome, everyone. I'm Dr. Steve Rasner, and you're tuned in to The Lionhearted Dentist. First thing I want to say this week is I'm going to be talking clinically about some additional tips that you may or may not have thought about, and I think they're excellent. I mean, I'm really excited to share them with you. They're not profound by any stretch, but sometimes we need somebody to kick us in the butt and remind us perhaps the best way to move forward. Another thank you to whoever's following me in Germany and Ireland. I think when the live lectures come back, I'm going to reach out to you. That's the first place I'm going to go because I seem to be resonating with some of you out there. Not so much love in South America. I don't know. Wish you guys would listen to me too. Anyway, let's get to it. So my first clinical tip for the week, you're going to poo-poo. You're going to say, really? Like, I don't know that? I don't know if you do know that. And the tip is slow down. Hear me out before you turn the radio back on. I said slow down with your procedures. So how do you do that? Well, you do that by giving yourself more time per procedure. Remember, when I prepare to do these weekly podcasts with you, what I try to do is think of the things I wish I had known, or thought about 20 to 30 years ago. So I can tell you, I remember 30 years ago looking at my schedules and being impressed by how many things on the schedule that I had to do. Crown and bridge cases back then, lots of them. Just one after the other. And here's the thing. 5 years goes by in a blink of an eye as a dental professional. Even 10 years does. I'm telling you it does. And a patient may fall out of treatment for a little while and come back in and, you're looking at the work that you did years ago. And I'm telling you, there's an incredible amount of satisfaction of looking at work that held up no matter what, no matter the fact they hadn't kept their hygiene recalls and etc. Yeah, you want to look back. We all like that, don't we? And the number one Achilles heel to your work holding up, to you providing your very best with whatever procedures you're doing, is not having enough time. Everyone listening right now can surely relate to that hopeless feeling that we have sometimes when we're behind in our schedule. Maybe it's because you had a difficult patient, a gagger, just one that couldn't get numb. And it puts you behind, 45 minutes right out of the gate. And then, of course, that's the day that you have somebody traveling 2 hours to see you that used to live in your community that moved away, but they still come to you because they trust you and like you so much. And now you're really feeling, oh my God, what do I do? By the way, I'll tell you what to do in just a second with that. So here's the thing. You might be saying to yourself, well, if I slow down my procedures, Steve, I'll make less money. I don't think you will, and I certainly don't think you'll notice over the course of your career, which is even more important. If you do a lot of restorative dentistry or surgical dentistry as well, like I do, there's a thing called redos, a redo, R-E-D-O. That means work that you feel obligated to redo because of whatever. Maybe it was as simple as a direct class 2 restoration that has an open contact over the years. The patient comes back for recall and says, I got a food trap on my upper right. That's the only thing bothering me. Can you look at that for me? And the hygienist goes in and kind of a light contact visually. She goes in with floss and sure enough, or even worse, sometimes the light contact that you put in has now resulted in caries on the both teeth adjacent to the food trap. I've seen that many times. And it could even be a crown that you did. And quite honestly, it's embarrassing to me. And that becomes very often a redo in my office, because I feel if patients are going to pay me the fees that I put out there, I have not been hesitant to tell you that if you have trained for excellence, then I don't see a problem in you charging appropriate fees. We are not all the same. But what goes with that for me is being honorable. We all make mistakes. And none of us have the ability to remember every procedure we did or what we did and what went wrong. So here's what I find. I'm telling you, I've done this for a few years now. I didn't always do it. But by adding, I'll add 30 to 60 minutes to almost anything I schedule these days. And yes, as a result, in less patients per day, yeah, it does. And I like it that way. And I'm not saying that to you because I'm later in my career and I'm in a better financial position to make such decisions. I don't think you'll get in a great financial position by cramming as many patients per day or procedures per day as you can. I really can't emphasize enough what I'm saying to you right now as a clinical tip that I really think will help you. I mean, I almost never, I've been really pushing this for a few years now. It started about 5 years ago. And you know, when I walk into my day, don't you like to look down at your schedule? I don't mean a moth-eaten schedule that has openings in it because you're not busy enough. It does a lot of things. It gives me more time to converse with patients in hygiene. I just don't feel rushed. I'd like you to try it. I'm going to recommend that you try it for a week, a couple weeks. So the next week that you have open, where you can impact, or the next, start scheduling tomorrow and adding a half an hour or an hour. Just try it. You know, you have an easy root canal and it's only going to take you 45 minutes, an anterior canal. Add a half an hour. What's the difference? So maybe you have more time to go into hygiene and connect and emphasize the relationship building practice that you hear me speak about so often for you, that you should be pushing. I got to tell you, and I think most of all, you will cut down on the redos that you find yourself, doing at times. And let's not pretend that we don't all have mistakes that we feel obligated to fix, or make better. So slow down, enjoy what we do each day a little bit more. Look, if you think the road to getting really rich is fast dentistry, masses of people, by you the clinician. I don't know, what happens if you have 5 offices and have other clinicians doing this for you. I don't think that's the road to financial success. I think that's a whole nother podcast. And there's a limit. I mean, we're dentists, and you can certainly retire with significant 7-digit bank accounts. But you probably make most of that money by wise investing, by wise living within your means, if you can be that disciplined. Gosh, I could go on and on with this stuff. So I got to tell you, what happens when you do that is, it's true that patients will have to wait longer to get their appointments with you. But if you're building the lion-hearted practice like I advocate, like I know so many of you are, I can tell by your emails, I can tell by the journey that you're taking on with CE. Lots of you are learning and getting your oral sedation permits that you've written to me about. Taking on, surgical procedures for the first time in a long time. I will tell you that you will be plenty busy and patients will wait for you because you're worth it. The next thing I want to talk to you about is to at least because I thought about this recently, have some form of, I'm encouraging you to try some form of sedation, oral sedation in your practice. Now, I've been over the top with you with my oral sedation protocol, which to me is I'm really think it could be the best clinical gem I was ever given and had the most influence. If I had to pick one, it would be that in my 40 years of practice. I don't think it's even close. Because bringing oral sedation into your practice impacts so many aspects of your practice. It allows you to brand. You can advertise oral sedation a lot easier today than you can even aesthetic dentistry, because there's so many people pushing aesthetic dentistry, and it's so hard for the consumer to distinguish who really is good versus who isn't. But to promote sedation, you have to deliver sedation, and not every clinician is willing to do that. So just on that level, but on a much greater level, it makes your work better. Because here's the thing, whether you're doing surgery or not, if you're just doing crown and bridge, and you have a difficult patient, which, come on, it can't be unique to me to have these patients come across my desk who are just challenging. You know, they've had bad experiences, and of course in my particular journey, I've done the sedation thing so long that everybody probably in a 40-mile radius, a lot of patients and even some dentists know that I do that, and they're not willing to do that. So they send me patients. So what I'm saying to you is, even if you're doing crown and bridge, it absolutely compromises your skill set. If you have a jumpy patient in a chair, now you're into the preps and you can't abort. You have to finish the procedure you did. So if you don't want to get the full sedation license, most of you listening, and even those of my friends in Europe and across the world, are allowed to use one, and some of you have broader sedation bylaws and privileges than we do here in parts of the United States. Like, for example, I believe in the state of Connecticut, I'm not even sure you need, don't hold me to this, but I'm not even sure, at least up to a couple years ago, you needed a permit to give more than one sedation drug. So why not at least try nitrous? And then, if not nitrous, a lot of your states will permit you to use one drug, not combine two. As soon as you combine two, you need a permit. You have to look up your state board regulations to verify that. I'm not an expert on your state, obviously. But if you don't want to go out and get the full 60 hours of what it takes in like the state of New Jersey to have a permit, then why not try just on a lesser level? Your patient will not be as sedated as mine. Try triazolam. Try 0.25 milligrams of triazolam. You know, or certainly those of you that have access to nitrous could try nitrous. I will tell you that nitrous alone or triazolam alone will not compare to the level of sedation that my protocol results in. You know, mine being Benadryl, Atarax, triazolam plus nitrous. It's just amazing. I'm telling you, I've been over it many times on this podcast. It's amazing. It truly is. Amazing in consistent outcomes, amazing atmosphere to practice dentistry in, to not have stress, to be able to give it my very best version of my dentistry. Seriously. Which completely gets compromised when I have that patient says, oh, I don't need sedation, which is rare. I had a patient this past Tuesday that had to get a tooth out this week before we start his big case, which is going to start in about 3 weeks. And he didn't want to sedate for one tooth. And the patient could not be reclined, which I could have reclined him more if he was sedated. So I'm working on a patient sitting upright in the chair with a gigantic beard that I cannot see through, and I'm trying to remove a lower left premolar with a long root broken to the gum. I will tell you, my back still hurts, and it was 5 days ago. Are you kidding me? It affects everything, guys. I know I come on here and I promote surgery for you. I'm telling you today that even if you don't do surgery, do yourself a favor and look into some form of sedation for your patients. You know, unless you're doing direct class 2, class 1 composite dentistry. And even that, to be honest with you, why would you not pursue this? What do I have to gain by pushing this on you every other podcast, except for you to have a better experience each week as a dentist? So I guess the takeaway here is I'm saying this. Even if you don't want to go full boat in your country, if you're in Europe, South America, India, wherever you guys listen to me from, then find out what you're allowed to give and experiment with that without getting, in other words, when I say experiment, see how, if what I'm telling you resonates for you in your hands, like wow, this is easier. Rasner's right. This is a much better way to go. And then go full boat and get the permit required in your province to just, it changes the whole package of what we do each day. Okay, the next thing I'm going to say, and probably the last thing, those of you in the next couple months come across a terminal dentition patient that is going to require a denture, I'd like you to consider the following protocol, and you're going to benefit from it in about 3 ways. And I have said this before, but that's my tip for this week, and it's this. Treatment plan, not just the removal of their teeth, not just the fabrication of a denture, but also treatment plan, a relatively inexpensive, let me elaborate on that. Relatively inexpensive would mean an acrylic partial with wrought wire, bendable glass, nothing sophisticated, that this patient will wear for every bit of 2 or 3 months while they're in the process of having the denture fabricated. Now, why am I telling you to do this? And we charge, I think, like, depending, because sometimes it's just 4 teeth and sometimes it's 8 teeth on this prosthesis. So it can range from $750 to $1,250. And I'm not telling you about this because you get an extra $1,250, for God's sakes. I'm telling you about it because it's a much better management and a better outcome. Here's why. Number one, these patients often come to you with just horrific aesthetic presentation. They're missing a front tooth, other teeth are broken. They have made the leap in their life to do something about it, and they're coming to you. Well, wouldn't it be great in a matter of like 10 days to 2 weeks if you had something in their mouth that made them feel better about themselves? So what you do is your goal is to keep, obviously, a minimum of 1 tooth on each side posteriorly, even premolar and back, or even preferred, if you can, 2 teeth on each side. All the teeth in the aesthetic zone will go. Okay, so and this is not difficult in terms of fabrication. You're going to take impressions and alginate. You'll take a bite in Siltec, and you'll select a tooth based on your existing teeth contours and a shade. And you'll instruct the lab which teeth are coming out and which teeth to replace. I mean, I've been doing this for 20 plus years. In terms of the teeth that you're going to keep transitionally through the process, they can be broken down. They could have a periapical abscess and be asymptomatic. You're not looking for outstanding, amazing teeth. Anything you can hold on to. I mean, if it's got a 2+ mobility on a scale of 1 to 3 and it's painful, then no, you can't keep it. And there are occasions where I have to keep just one on each side, and even occasions where I can't. I just have to go with immediate denture. Here's the advantage. The advantage is to transition for the 3 months after you extract the teeth is a little easier for the patient, even with 2 teeth being clasped. It's absolutely a little easier for this patient to accept this. Okay, so number 1, they get something immediately, and it inspires them. It makes them say good things about you. Number 2, they get used to using a prosthesis for the first time in their lives. Number 3, as you begin to make the permanent, obviously their tissues are in better shape 3 months after you've taken the teeth out. And you can try in the final case, with the exception of the couple teeth that you've maintained, and get a true aesthetic assessment as opposed to an immediate denture. Again, it's not about that it adds $750 or $1,250 or whatever the fee is. It's about you having better outcomes at the end. We also, by the way, include a reline in the fee of our immediate full dentures. And I rarely do full dentures on a mandible. I should add that, as I'm sure most of you don't as well. So, I hope this helped you guys. The takeaway this week was slow down. Really, just try it. Try it for a week. And don't worry. If this is the reason why you're not financially successful, then you're wrong. You're looking at the wrong parameters. It will not be the reason why, by you slowing, eliminating maybe 1 patient a day or even 2. Remember something else. The guy talking to you each week from the Lion-Hearted, me, walks his talk. So I do have a sedation practice pretty much. Certainly enough that I have at least 1 or 2 patients a day sedated that are taking up 2 to 3 hours of appointments and are massively productive during those 2 to 3 hours because they're sedated. I can do more things. So it is easier for me than you, perhaps, to take this road. But even if I didn't, just try it. See if you enjoy dentistry more. This is tough what we do. Even the way I do it, it gets tough at times. We picked a hard profession, man. So let's make the best of it and give you the longest career and not have you burned out. We all have colleagues, don't we, that just hate this and are finding anything to become good at other than dentistry. Well, that's not the Lion-Hearted. I'm here to tell you that you can have a fruitful, productive, lucrative career, and a long one, if you do it the right way. Have a great week. I'll see you next week on the Lion-Hearted.